Hello, my name is Emma Turnage, and today I'm going to be discussing vegetarian and vegan diets and their effect on depression prevalence and incidence. The objectives today are to define depression, its symptoms, diagnosis, and treatment, and discuss how vegan and vegetarian diets affect depression rates. We're also going to discuss a couple of reasons behind this effect. So, those who are vegetarian do not eat meat. There are variations such as pesco-vegetarians who eat fish, or lacto-ovo vegetarians who eat dairy, eggs, or other animal products. Vegans, on the other hand, eliminate all meat and animal products from the diet. So depression is relatively common. It affects about 1 in 15 adults each year. 1 in 6 people will experience depression at some point in their life, and 1 in 3 women will experience a major depressive episode in their life. So again, this is not a rare issue. This is relatively common, but it is still an issue. Depression usually first appears during the late teens to mid-20s, but it can appear at any life stage. Major depressive disorder can cause feelings of sadness and a loss of interest in activities a person once enjoyed. It can also lead to changes in appetite, weight loss or weight gain, changes in sleep pattern, and that can also be an increase or a decrease in sleep. It can also cause feelings of worthlessness and thoughts of death or suicide. These symptoms can range from mild to severe. It is also important to remember that other depressive disorders exist, but we will just be focusing on major depressive disorder today. You can see the diagnosis criteria on the table on the right. For diagnosis, at least 5 symptoms must last at least 2 weeks and cause a change in the previous level of functioning. Typical treatment methods for depression include medication, such as antidepressants, and psychotherapy, also known as talk therapy. Before I discuss this study, I wanted to first say that I am going to be examining many studies that looked at depression and other mental health disorders. So you can see this one examined depression, anxiety, and stress symptoms. But I am only going to be focusing on the reported results for depression. So this first study was a systematic review and meta-analysis, which included 11 studies. You can see here on the right, some studies showed a positive association and some showed a negative association between vegetarian diet and depression, but you can also see that many of them were close to having no significant association. And again, on the bottom here, this little diamond shows the pooled effect, which showed no significant association between vegetarian diet and depression, and that effect was 1.02. This next study examined depression prevalence in a few different populations. So the data was obtained from the Bochum Optimism and Mental Health Study, or the BOOM study, which collected data between 2012 and 2014. So first, they completed a cross-sectional study comparing vegetarian and non-vegetarian adults and the rate of depression in Germany, which they included about 2,000 Germans, Russia, which was about 3,000 Russians, and America, which included about 3,000 Americans. They also completed a longitudinal study of German and Chinese students with 1,600 German students and over 12,000 Chinese students. The exact number of vegetarians were not given for each population, but the rate of vegetarians ranged from 2.8% of Russians to 22.2% of Chinese students being vegetarian. The results of this study showed no significant associations between vegetarian diet and depression in the American, German, or Russian samples. However, there was a small but significant association in the Chinese student sample with a correlation of 0.11. Here I have a couple quotes from this study. Vegetarian diet was predictive for depression and anxiety in the Chinese student sample. One potential reason for the differences in results across cultures may lie in the differing rates of vegetarianism across cultures. Chinese students were the most likely to report being vegetarian with a rate of 22%, as compared with 2.8 to 16% in the other samples. It may be that Chinese students' reasons for being vegetarian differ from the reasons for being vegetarian in the other samples. It could be that the Chinese students are more likely to be vegetarian for cultural reasons or economic reasons, as 67.35% of vegetarian students were in the low family affluence, or the FAS, scale group. In this study, the FAS is an objective measure that they used to measure family wealth. So this scale asks questions such as if the family owned a car or a house. And continue with the quote now. Whereas people in other countries may be more likely to adopt a vegetarian diet for health or ethical reasons. So here the authors are stating that although vegetarian diets were associated with depression in the Chinese student sample, there may not be a direct causative relationship between the two. Before I move on to talking about other studies, I wanted to discuss a few more reasons why we might see this link between vegetarian diets and depression. So first off, the onset of depression often occurs before a person changes to a vegetarian diet, and we will see a study in a little bit that examined this. Second, the reason for a person choosing to be vegetarian may be associated with depression and not the diet itself causing depression. So, for example, as we saw in the last study, 2/3 of Chinese students had a low affluence, so this may be more associated with depression than diet, although the link was not examined in that study. Another author also proposed that those who are depressed may have more of an emotional bond and may choose to become vegetarian for ethical reasons because they have a higher emotional bond. There also may be a reverse causal relationship where individuals who have a psychosocial disorder may be more willing to become vegetarian or vegan in order to try to improve their mental health. Another reason is that many nutrient deficiencies that are common in vegans are linked to an increase in the risk of mental disorders. These nutrients include certain amino acids, such as methionine, tryptophan, and tyrosine. However, only vegans could be affected by these, as fish eaters have the highest level of these amino acids even compared to meat eaters. And the reason for this is that these amino acids, along with lysine, arginine, and beta-alanine, are important for neurotransmitter synthesis, such as dopamine and serotonin, which are important for mood regulation. And in depression, these neurotransmitters are lacking. Other nutrients include omega-3s, vitamins B6, B12, as well as zinc and creatine. This also just provides another reason to ensure that those consuming a vegan or vegetarian diet are also consuming the adequate intake of nutrients. Another proposed reason is that in many countries, vegetarians and vegans are a minority, and being a part of a minority may reduce feelings of well-being. Lastly, the socio-demographic factors associated with vegetarians are also similar to those of mental disorders. So these factors include those who are predominantly female, single, and live in an urban area. And this next study we will discuss took this factor into account. Again, this study examined vegetarian diet and mental disorders, and they also controlled for those socio-demographic factors by matching the non-vegetarian population to the population demographics set by vegetarians. The participants were responders to the German National Health Interview and Examination Survey, or the GHS. It included 4,181 Germans. 3,872 of them were non-vegetarian. 1.3% of them were vegan, with 48% of those vegans having not eaten fish in the last 12 months. And 4.5% were predominantly vegetarian, with 14.7% of vegetarians not eating fish within the last 12 months. The matched group included 242 non-vegetarians, and again, this group was matched to the socio-demographic factors set by the vegetarians. So this table shows the average age that individuals had an onset of depression and the adoption of a vegetarian diet. As we can see here, the average age of the onset of a vegetarian diet is around 30, which compared to depression, which is around 25. This shows that on average, the onset of depression precedes the adoption of a vegetarian diet. Again, just another reason why this may not have a causative relationship. Results of the study showed significant associations between depression and the completely vegetarian group in the 12-month and lifetime prevalence. Additionally, there is a 15% increase in the lifetime prevalence of depressive disorders in the completely vegetarian group compared to the non-vegetarian group. As you can see on the bottom here, the lifetime for the completely vegetarian was 35.2, compared to about 20% in both the non-matched and the matched sample of non-vegetarians. This study is another cross-sectional study. The data came from the ACON longitudinal study of parents and children, or ALSPAC. The participants included almost 10,000 men, with 311 of them being vegetarian and 39 vegans. The Edinburgh Postnatal Depression Scale was used to assess male partners and mothers, and although this scale was developed for postpartum mothers, it has been proven effective for male partners as well. With the EPDS, the higher the score, the worse the depression, with a score over 12 indicating severe depression. However, the authors measured the number of individuals with a score over 10, as this also will include individuals with mild and moderate depression. Results showed that vegetarians had a higher mean depression score compared to non-vegetarians, with vegetarians averaging 5.26 compared to 4.18 in non-vegetarians on the EPDS score. Vegetarians also had a higher proportion of men with an EPDS score above 10, with an unadjusted odds ratio of 1.75. On the table on the right here, this proportion was adjusted, And the odds ratio is still 1.71 when adjusting for housing tenure, number of children in the household, age, religion, family history of depression, and child psychiatric contact. The adjustments were further increased for alcohol and tobacco consumption, marital and employment status, and the odds ratio remains elevated from the reference of 1, and the odds ratio remains elevated at 1.67. The authors also found that the longer a person remained on a vegetarian diet tended to increase the depression score. This study was a systematic review that included 23 studies. They found that 11 studies showed an increase in depression in those consuming a vegetarian or vegan diet. 7 of them found no association, and 9 of the 25 showed a lower risk. However, the authors indicate that these should be taken with a grain of salt, as those that found a lower risk only scored fair in a quality assessment score. This is the final study I have today. It is a systematic review and meta-analysis that included 13 studies, with 9 of them examining associations with depression. This table shows the association within each article, with the square indicating the mean and a larger square indicating a higher quality assessment score. So as you can see, this one on the bottom had the highest quality assessment score. They found no statistically significant differences between vegetarian or vegan diets and omnivores and the incidence of depression. As seen here in this little diamond, there was no significant association. They did find, however, that vegetarians and vegans had a higher incidence of depression in those under 26 years of age, and those studies had a higher quality assessment score, and you can see here the association was 1.739. Finally, I have a quote from this study. In this meta-analysis, vegetarian and vegan diets had no effect on the continuous outcomes of depression, stress, well-being, or cognitive impairment, but vegans and vegetarians were at an increased risk of depression when depression was assessed as a categorical variable with an odds ratio of 2.142, and this was found in 2 different studies. So in conclusion, individual studies are inconclusive. Some find an increased risk of prevalence. Some find no significant associations. However, meta-analyses do show that there are no significant associations between vegetarian diets and depression when compared to non-vegetarian diets and depression. Most of the authors do indicate that if there is an association, it is likely not causal for the reasons discussed earlier. So that would be, again, the reason for becoming vegetarian may be more associated with depression than the diet itself. The reverse causal relationship and socio-demographic factors are similar between the two, as well as nutrient deficiencies. However, I do believe that more research needs to be done into this topic. In specific, I would be interested in seeing research into nutrient deficiencies in vegans and how the depression prevalence varies between those with deficiencies and those without deficiencies. And that is all I have today.